Okay. So welcome along, welcome to our webinar. So this is a Lynton webinar, but today we're doing something a little bit different. We're hosting the National Medical Weight Loss Programme from the fantastic Sandy Green. And the reason we're hosting this is because Sandy's actually been one of our customers for 17 years now. So quite a long time. And obviously upgraded and changed equipment, you know, over that time. But, you know, this time in the world, it's good to share and to give back and to say thank you. So Sandy is the founder of the National Medical Weight Loss Programme, a brilliant programme for you to think about introducing into your clinics. I think it really genuinely offers something different to help people who are struggling with their weight loss. And we're delighted today to have Sandy here, who's going to talk us all through that, along with Kadir Hussain, who is the CEO of Primed Pharmacy, who's going to be helping out as well, just to talk through the options available. So for those that can't see Sandy or Kadir yet, if you want to say something, guys, then you'll pop up onto the screens of those people who only have a view of me at the moment.
Okay, good afternoon everybody. Thank you for joining the webinar. We're looking forward to sharing all the information with you.
Perfect. Okay, good stuff. So we're going to be doing a variety of screen sharing and chatting directly to you today. We would like to make it a nice interactive informal session, so please ask as many questions as you like, get as much from this as you can. And there's two ways that you can ask your questions. You can either drop them into the Zoom chat box and then everybody can see those questions, or if you'd like to ask something privately, then you can do that in the Q&A, and then only the panelists only will be able to see those questions. So whichever you prefer, you can drop your questions into those formats. And we'll do our best once we've run through the presentation to come and do a bit of an open Q&A at the end and just answer any questions that you have as we go through. So for those of you that don't know Lynton, we're a British company. I'll just take a few moments to tell you about sort of what we do. We do lots of different devices. So hair removal, tattoo removal, body shaping, etc. We really specialise in very high-end aesthetic equipment. One of our best-selling systems is the Lumina. This is one that you have, isn't it, Sandy? And I think you like it so much you've got two over its lifetime, so to speak. So yeah, so it's a good one for really a really wide array of different treatments. So there's 24 different treatments out of that particular device. So it's really good to do kind of, I guess, as you've done at Elements, which is to start, Sandy, with certain treatments and then over time add more and more on. I know you've added different hand pieces onto it over time, indeed. Haven't you?
Yeah, it is such a versatile platform. Really, really very, very good.
We see some of your results on social media, so yeah, they're fantastic. You've got a great team there getting the most out of it. But we do have a big array of different systems, and just following the talk today, I'm going to just spend a few minutes talking to you about one particular machine that we actually sell on behalf of a huge laser company. They're called Deca. They're actually based in Florence, but they sell worldwide, one of the biggest laser companies in the world. So although we are a British manufacturer, as you can see here, we manufacture the Lumina in Manchester. We do actually also sell on behalf of some other suppliers, and one of those suppliers is Deca. And they have launched a really revolutionary body shaping machine, which works very well alongside the National Medical Weight Loss Programme. So towards the end of the webinar, if you're interested in any equipment, then I'm just going to spend a few slides talking to you about why this body shaping machine is a little bit different to anything else out there. So I'll hand over to you, Sandy and Kadir, and enjoy. I'll monitor the chat. Would you like to wait until the end of your slides before we ask questions, or are you okay for questions to come in as you're going?
Absolutely fine for questions to come in as we're going, because there's two of us, we can actually see them, or okay. Indeed, if you shout out, Hayley, if we've got a question that's relevant to a particular slide, then yeah, okay. Please, we'll share that then.
All right.
Do you want to share the screen? Have you shared?
Yeah.
You share. Ah, you're sharing?
Yeah.
Okay, perfect.
Yeah,
Okay.
you're sharing, you're all good to go.
Okay.
Thanks, Hayley.
Good afternoon, everybody. So thank everybody for joining this webinar. So I'll begin by introducing myself and kind of following on from what Hayley just mentioned a short while ago. So my name is Kadir. I'm the CEO of Prime Pharmacy. We're both an NHS pharmacy and also an aesthetic pharmacy based in Yorkshire. Our customers do go across the country, but we're operational from Yorkshire. And along with me here, I have Sandy Green. Sandy's background is within the NHS, but has been working within the aesthetics industry since 2003. Sandy has a fantastic clinic in Doncaster, and you do, and is also the founder of the National Medical Weight Loss Programme. And the reason I'm getting involved with this is I think the National Medical Weight Loss Programme is a fantastic programme, and it's a fantastic opportunity, first and foremost for patients, but then also for healthcare professionals to make weight loss treatments accessible to patients within this country. And before I kind of go into some of the details around my presentation, so we're kind of going to follow a format where I'll do a little bit and then Sandy's going to take over, and then I'll explain the pharmacy's role from there. But to begin with, what I'd just like to say is my background's in the pharmaceutical industry, and I worked with a couple of medicines around type 2 diabetes and obesity, and I just became very, very interested in the world of obesity and helping people manage the challenges around this area. I started to work with Sandy a couple of years back when Sandy founded the National Medical Weight Loss Programme, which is an education and development company which helps healthcare professionals, as I said earlier, helps healthcare professionals deliver successful weight loss services. So what I'll do now is I'll kind of have just an opening slide before I hand over to Sandy. Yep. So what I wanted to get across with this slide was the size of the opportunity, and I'm coming this from two different perspectives. There's first and foremost as a patient, because obesity and weight loss and obesity is such a challenge for so many people within our society right now, and by offering something that's linked to so many different aspects of people's lives, so to have something available which can help people achieve weight loss and it's evidence-based, I think is quite groundbreaking. Just to give you some context, that we've not had any medical treatments and pharmaceutical treatments for obesity since 2009, and now we have a couple of options which have really changed the whole landscape. So the purpose of this slide is to just give you some understanding of the scale of the problem. So 35.6% of adults in the UK are overweight, and overweight is defined as between 25 and third BMI of 30. A further 28% are obese. So the total overweight and obese is nearly 65%, and in 1 in 8 are morbidly obese. Okay, as I mentioned earlier, in 2009 there was a pharmaceutical treatment called Subcutaneous, which was withdrawn from the market, and it was the only real treatment out there which produced results. There were some concerns with that treatment at the time. Since then, and for the subsequent 8 years, there haven't been any treatments available. So in the last 2 or 3 years, with the launch of one medicine and a number of other medicines which are now in the pipeline, I think this is a wonderful opportunity, first and foremost for patients, but secondly, it's created an opportunity for healthcare professionals to develop sustainable and commercially viable businesses. We know that aesthetics is hugely competitive, and what we'd like to think is this is a new and a quickly growing area within the industry. So for those healthcare professionals who are kind of looking at how they can improve their existing setup, how they can add additional services, I think you'll be really quite pleased with Sandy's presentation. So I'll hand over to Sandy now, who can go through the National Medical Weight Loss Programme.
Thanks very much, Kadir. Okay, so I'm just going to jump straight in. There's quite a few slides for me to go through, but this is really just a taster of some of the education that you'll get. And again, we're going to be touching on how big the problem is, but then also looking at the benefits that we provide as the National Medical Weight Loss Programme that you would benefit from by becoming one of our certified partners. So I'm just going to very simply take it right back to the beginning and look at the definition and classification of obesity according to the World Health Organization. And they actually define obesity as a serious chronic disease associated with having excess body fat to the extent that it may have a negative effect on your health. And a crude measure of how we actually, a crude measure of obesity is quite simply the body mass index, which is a person's weight in kilograms divided by the square of their height in meters. And quite simply, BMI classes fall into 6 different sections. And here they are. I'm just going to put my little annotator on so that I can just actually demonstrate things to you. So this is the normal weight that we'd like all of the population to sit in. But you can see that there's people that will sit in the underweight category, and then also the overweight category and moving into obese. So a person with a BMI of between 25 and 29.9, which actually isn't very high, is still classed as overweight. And then anyone with a BMI above 30 is classed as obese. And there are 3 different categories within obese. There's obese class 1, class 2, and then class 3. Now, when we actually break this down further, it becomes very clear that obesity is associated with multiple risk factors for health. And we're going to be talking about that in great detail this afternoon. So the higher the category of your BMI, the increased risks of comorbidity. So somebody with a healthy weight range has an average risk of developing associated diseases, and they increase as the BMI actually increases too. So just refreshing your memory from the statistics that Kadir actually reported at the beginning of the presentation. These statistics come from the House of Commons briefing paper from last August, and those statistics are from data from 2 years ago. That's generally how it works. So over a third of adults in the UK, so 35.6%, are overweight. So that sits in that category of 25 to 29.9. Almost another 30% are actually obese. So the two calculated together means that the total population in the UK of patients or people living with overweight or obesity is almost 65%. That's almost 2/3 of the adult population are living with overweight and obese. And actually 1 in 8 of those people are actually living with morbid obesity. It's now referred to as complex obesity, but i.e. a BMI of over 40. Now, they're not the worst statistics because, again, the shape of things to come, written by or presented in the Foresight report from the government in 2007. And the report estimates that following the current trends that we're on now, if we don't take any action, that 60% will increase to 90% of the entire UK population being either overweight or obese in 2 generations' time, so in 2050. And by that year, it's estimated that obesity as a cost to the UK will be almost £50 billion per annum, just dealing with the consequences of obesity. So let's have a look at this thing that we call obesity. There's 2 different types of fat that you'll learn about in great detail on the course. There's visceral fat and subcutaneous fat. And quite simply, you can actually look at somebody and determine whether they're carrying a lot of visceral fat, and they tend to be the people that have an apple-shaped body. So most of the fat is carried around the central part, which is actually internal, versus the subcutaneous fat, and they tend to be the pear-shaped people of this world, where the majority of fat usually sits quite subcutaneously. Now, visceral fat has a greater risk of cardiometabolic disease, so it's much more relevant to actually be looking at waist circumference when we're actually looking at people's obesity statistics. If you actually have a look at the impact of excess fat, you can see the yellow in here, in and around the organs, completely filling this internal cavity, is visceral fat. And what that means, if you look at a functional MRI scan, this person is 17.5 stone against this person of 8.5 stone. They're both women. Then you can actually clearly see the impact of excess fat. The obese person will suffer with crushed lungs, particularly when she lays down, because the fat on the internal side of the organs will flatten as she lays down, and she'll find it difficult to breathe. The person with obesity will also suffer an enlarged heart, because that heart has to work harder, so it increases in size to be able to pump the blood around this oversized body. And she's almost certainly going to suffer with strain on her joints, so hip joints, knee joints, and ankles. So anywhere where there's weight-bearing joints, she's really going to start to struggle. Just another pictorial image to show you the difference between a healthy heart and a heart filled with visceral fat. You can just see that that heart will really struggle to pump because it's just carrying so much excess visceral fat all around it. So if we look at some more effects on health, and this is the relative risk of health problems associated with obesity. So we look at the different types of disease, and then we've got a section for women and a section for men. But when you look at type 2 diabetes, or T2D, women who live with overweight and obesity are almost 13 times more likely to develop T2D than those who are in the normal healthy range. And that figure for men is 5.2. If you look down at the risk of developing colon cancer, a man who lives with obesity is 3 times more likely to develop cancer of the colon than people living in the normal health range. In the training that we do, we kind of go through a number of the different associated diseases and pathophysiologies associated with obesity, but excess body weight is associated with multiple conditions, and as a result, obesity has been found to reduce life expectancy. And that's demonstrated really nicely on Novo Nordisk's website, Rethink Obesity, and it's identifying that those people living in the normal healthy weight range have an 80% chance of reaching the age of 70. When the BMI increases from 30 up to 35 to 40, that reduces down to 60% chance of getting to the ripe old age of 70. And for people with a BMI above 40, they only have a 1 in 2 chance of getting to the age of 70. Which is really quite alarming and really quite shocking. Some of you will have actually seen these cancer research posters everywhere, either in your GP surgery or up at the hospitals. But obesity is a cause of cancer, and it's actually the biggest preventable cause of cancer after smoking. And these are statistics produced by Cancer Research UK. This is the number of deaths associated with cancer from smoking, and this is the one from obesity. So these are annual numbers, almost 25,000 people dying with obesity-related cancers. And actually, overweight and obesity is the UK's biggest cause of cancer after smoking. We've mentioned that, but obesity has been linked to causing 13 different types of cancer, and they're all listed here. Now, interestingly, the larger the circle, the higher the prevalence of actually developing that type of cancer when you're obese. So let's then look at how we actually treat obesity at the moment in the UK. Now, this is a model referred to as the tiered approach to obesity, and the model was actually designed by Dr. Matt Capehorn, who is actually a co-author and co-deliverer of the training. I'll talk about Matt in a little while, but it was his actual Tier 3 service in Rotherham that actually came up with this scenario or this model. So tier 1 interventions are your universal interventions. They're the health promotion campaigns. So Health Matters, Eat Well, 5 a day, and it's the government that's actually responsible for those. When we look at tier 2 interventions, it tends to be the individual that will do things to actually help themselves with their weight. So they might join Slimming World or Weight Watchers or try Lighter Life, things like this. Now, it's not until you get to the tier 3 services, so the specialist services, that you start to look at multidisciplinary team approaches, and they're generally medical led, and you start to look at the pharmacotherapy, so prescription medicines for the treatment of obesity. You might look at psychologists and nutritionists, so a real multidisciplinary team approach, and that's where we come from. And then finally, tier 4 services are all your surgical options, so your gastric band, your gastric sleeve and bypass. Now, gradually over the years, we've seen a decommissioning of services, but prior to 2017, NHS England offered 100% availability for all tier 4 bariatric surgeries for those patients that met the inclusion criteria. And in 2017, CCGs took over commissioning, and already by the end of that same year, that 100% figure came down to just 73%. Matt believes now that it's actually closer to 50%, which is really quite alarming when these people need assistance and support. So there has been a gradual erosion of obesity services across the UK, with many clinics closing. GPs are no longer funded for prescribing 2 of the 3 licensed weight loss medications available to treat obesity in the UK, one of them being Saxenda. Some of you will have actually heard of this, and the other being Mysimba. And that's not because they're not effective, but it's because NICE has actually decided they're not cost effective. So you won't find a GP who's physically able to prescribe Saxenda on the NHS. Now that means that we have nowhere, or rather people living with overweight and obesity have nowhere to go to for help, support and treatment. And now this is a problem. And this is when I actually identified the solution, because not only do I want to provide that service, I actually want to help others be able to provide that service in your localities too. So it's our vision to ensure that everybody living with obesity has access to treatment. And you can do that simply by becoming a registered, if you're a registered healthcare professional, you can do that by setting up your own private weight management services and become a certified partner of the National Medical Weight Loss Programme. Who do we train? Well, we are strictly medical only. So provided you have got a registration number with whatever body, it might be HCPC, it might be GMC, GDC, NMC, provided you have got a registered qualification, we will review that and you will be able to train with us. So you don't have to just be a prescriber. For all these others, you have to be a prescriber. But if you're a nurse, provided you have a prescriber that is either done the course with us or a nurse and you use our prescribing course, our prescribing services, you will be able to offer that service. So what do you actually get when you become a certified partner? Well, one of the key things is that you will get expert accredited training. And our training is not only CPD, so you'll get your points there. It's a recognised training course with our partner insurance company, Cosmetic Insure. But some things that I'm really proud of, took us 9 months to do, but we have our course accredited with the Royal College of Nursing. It's accredited through the World Obesity Forum, the Federation, World Obesity Federation, through SCOPE. And SCOPE stands for Strategic Centre of Obesity Professional Education. And that is as high as you can possibly get. This is a global accreditation that you're referring to or looking at there. So we also have an expert trainer. Matt helps me deliver the course. There's no end to his credentials. If you want to see more about those, please just go onto the website. But the key ones are that he's an expert advisor to NICE. and he also presents to the all parliamentary group meetings on obesity, and so on and so forth. When you look at the agenda, it's a very intense course. It's run via face-to-face webinars now, which means you can actually do the course from the comfort of your own home. Some people will sit there, sat on the bed, sat in the bedroom, sat outside. The choice is entirely yours. But we cover 4 modules each day. It takes the whole day because we really go into great depth about the epidemiology and understanding things. We look at the fat cell, the metabolism, all the different hormones that regulate appetite. Before we then look at different weight loss interventions, excluding the pharmacotherapy, so excluding any medications, but we really do go into quite some depth about what the options are before we then start to look at the medications, and we cover phentermine, orlistat, mycimba and liraglutide, which is Saxenda, on day 1. On day 2, we start to look at some more novel agents when it actually comes to pharmacotherapy. So semaglutide is also a GLP-1 analog, which is actually in the same family as liraglutide. It's made by the same company, but we actually talk about prescribing that medication off-label, and we go into really in-depth about the prescriber's responsibility, and look at the MHRA documents and the gov.uk. Then we spend the rest of the time really looking at helping you to set up your weight loss services. We have a clinical location that we can actually talk about, and then we have a virtual clinic that we can actually help you set up too. And then you've got lots of help and support. But we're going to be coming back to this virtual clinic because for us in our industry, obesity patients and obesity treatments really lend itself very, very well to be in a remote or virtual service. And I'm going to hand back over to Kadir shortly to tell you exactly how we can do that or help you do that. Insurance-wise, we use Cosmetic Insure. We've used them now for several years. They actually give our partners a really, really good deal on their insurance policies. Now, whether that's the entire policy that they convert over there, or they actually just take out a standalone policy for the pharmacotherapy to deal with weight loss, the choice is theirs. So let's have a look at some of the other benefits that you might have for being one of our certified partners. Now, one of the first benefits is this is the National Medical Weight Loss Programme website, and partway along you'll see Clinic Locator. So patients or browsers, potential patients can go on here to click on, and everybody's, this is nothing like it used to, like it looks now. There are a couple of 100 different locations on there now. But when you actually click on there, they can see who the locality or who the clinic is that's closer to them. And then if they click on that, there's all the details, so that the address, the website, the email, phone number, and you can start a consultation from there or just view more details. So that's the first thing, you actually get recognised as a certified partner on our national website. Now, everybody that's a partner gets their own personalised online consultation form, which you would then actually send out to your patients to complete. It's all done electronically. When that's actually submitted, that comes to your designated email inbox, all encrypted, so that you can actually vet that patient before you make them an appointment. So you're looking to make sure that they're of the right age, they're of the right BMI, and their health indications have no contraindications or cautions in there that you want to find more information about. You also have exclusive access to a huge Dropbox full of any and every file or information that you could possibly hope to actually find. But something that's actually taken on a life of its own is our closed Facebook group. And there isn't a delegate or a partner now that we've actually signed on that doesn't find this really, really useful. Delegates will, if they come across a patient that's a little bit tricky, they can put the information in there, and the group will just really help each other on giving advice on a particular scenario. So you really do gain access to exclusive membership support, and that support and guidance is ongoing. There's also lots of marketing material, not just leaflets and banners, but you get written testimonials. There's lots of posts that we already make for you that are pre-made that you can actually just use on your social media just to help you build that, build up the service. Now, one question that always comes up is around CQC registration. So I'm just going to take a little bit of time over the next couple of slides just to give you my take on things. Okay, so the CQC is a regulatory body and it's not an advisory one. And as such, they're not able to tell a provider which regulated activity they may or may not be carrying out. The only advice that the Commission can give is for providers to look at the scope of registration document, which should help them determine whether what they're doing falls within the scope of registration for any given activity. So there's an expectation that providers look at this document and then apply for registration if they believe what they're doing meets that CQC definition of that activity. So this is what the document looks like, and here's a link, but if you go onto our website and underneath partners, there's a drop down and it will say, is CQC registration required? You can just click on there and there's a link that will actually open this document. It's embedded in there. But I'm just going to spend a little bit of time talking about the regulated activity for services in slimming clinics. So this regulated activity captures services that are provided in a clinic that consist of advice or treatment and include a prescription of medicine for the purpose of weight loss, and are provided by or under the supervision of a registered medical practitioner. Now, when you actually look at registered medical practitioner, if you go to page 59 of it, so this is in their glossary of terms, the CQC scope document defines exactly what a medical practitioner is. And quite simply, it's a doctor who's fully registered with the GMC. So at this moment in time, yes, I'm aware that it's a bit of a pitfall in the document, but according to the scope document at this moment in time, only doctors or healthcare professionals working with a doctor need to register with the CQC to offer the regulated activity of services in slimming clinics. All other healthcare professionals at this moment in time fall out of scope. Something else that's quite interesting and really quite unique as well for those doctors that do have to register, this could be something that you might be interested in. So the regulated activity covers a slimming clinic, and the same document says, in order to be registerable, clinic, as in the slimming clinic here, is the activity, in this activity means it's carried out in a physical location rather than being a remote website service. So this is on page 55. This is the decision tree. Is the service provided in a slimming clinic? Well, if you're actually offering a virtual service and not from any physical location, then it's a no, and regardless of what profession you are, that service will fall out of scope. Continuing on the same screen, because I've highlighted different things that I wanted to talk to you about. So we've covered whether or not we need to have providers register for services in slimming clinics as that activity. But it may still be necessary to register for other regulated activities. For example, the regulated activity of treatment of disease, disorder or injury may apply if treatment is also being carried out for a condition that's not an obesity or weight disorder. The analogy that I'll use here is think about what you actually need to know is that obesity in the UK is not classed as a disease like it is in the rest of the world. So just like aging, obesity is not a disease. So just like aging, we're allowed to administer or we're allowed to prescribe and administer Botox for lines and wrinkles, i.e. part of aging, and we don't need to register for that activity because it's not a DDI. However, if we use Botox to treat underarm sweating or hyperhidrosis is a known disease, and to be able to treat those people, you'd need to register for DDI to be able to offer that service. Likewise, similarly, if that patient suffers from migraines and you treat that person with Botox or offer treatment for the treatment of the treatment of migraines, then again, you're treating a disease, you would need to register for that activity. Because we're only treating obesity, we're not treating any other diseases, then we don't need to register. I've lost a slide, I do apologise. We don't need to register for that particular, we don't need to register for DDI or the treatment of disease, disorder and injury when it comes to obesity. Now I'm going to hand you back over to Kadir, if I may, just to talk about, just to talk about how Primed Pharmacy can help you with your services.
Thank you, Sandy. Okay, I'm going to try and focus the next few minutes on telemedicine. So one of the things I think that's come out of this current situation and this pandemic is, I think there's a realization that that we need to be using more technology to deliver particular medical services, at least. I think within aesthetics, most services that we offer are limited by geography. But I think with obesity, I think there's a real opportunity to be able to use technology to deliver very effective services. And in some instances, it can be done more efficiently and more effectively than face-to-face. So what we do in Prime Pharmacy is we're an aesthetic pharmacy. I'd like to think that we try and do more than just deliver products. We try and work with the industry to try and develop innovative solutions to try and help clinics deliver services. So we've been a pharmacy since 2015, working primarily in the NHS. And since 2018, we've been working within the aesthetics industry. We have a specialist interest in weight loss. We dispense more weight loss products whilst working with healthcare professionals than any other pharmacy in the country. So we've got a number of arms to our business, but I will have to say that weight loss is something that we've been on this journey on, and we actually work with many healthcare professionals to help them deliver some of the services that they provide. I've gone through already sort of who we are, and in terms of our partnership with the National Medical Weight Loss Programme, where we support over 250 clinics nationally. We've got pharmacist support, which can help your clinics as well as clinicians. You can help your patients as well as clinicians. But the bit I want to focus on is around our ordering platform. So what we've done is as a pharmacy, we've just developed and launched a new ordering platform, which on one aspect, it's just another ordering platform, which is the same as others. So I'm not going to focus on that. The bit I'm going to focus on is remote consultations. So what we've developed is, over the last couple of months during this lockdown, is we've developed a video consultation software within our website, which allows you as healthcare professionals to carry out safe and secure video consultations. So the kind of background to this is currently, some of you may be aware of companies like Babylon and Push Doctor, and these companies have openly said that they've made more progress within their business over the last 2 months than they have in the last 2 or 3 years. Just because of lockdown, I think people's acceptance and readiness to take on technology to receive treatment has completely changed. Another kind of indicator is Zoom. Zoom a year ago, I think the share price was 15 pence. Currently it sits at 60 pence. Currently it sits at over 15 pounds. So that gives you an idea of telemedicine and the way it's effectively exponentially increased over the last 2 months. So what we've done is one of the concerns around telemedicine was security of platforms like Zoom when you're discussing patient data or sensitive data. So what we've done is we've developed a safe and secure video consultation tool that's part of our website. So what that allows you to do is carry out weight loss consultations with your patients, so they're done securely and compliantly. During this lockdown, one of the things that it may well be worth you guys looking into is the 10 guiding principles for remote prescribing. So the government, the various regulatory bodies, so GMC, GDC, NMC, GPhC, all CQC, they all came together to put together the 10 guiding principles for remote prescribing, because in anticipation of the increase of video consultations and telemedicine, so these 10 guiding principles effectively are there to protect the patient and protect healthcare professionals and to ensure that things are done safely. So what we've done with our platform, is we've taken these 10 guiding principles and ensured that our platform for video consultations complies with these guiding principles. So the key kind of points behind it are this: number one, it's a secure encrypted platform. Number two, unlike things like Google Hangouts or Zoom or whatever else, it's healthcare professionals only. So you have to be a registered healthcare professionals to get onto the platform. Number three, patients are verified and they upload their ID as part of this platform. And healthcare professionals also upload their IDs as well, so they're verified. So it's important that just as important it is for patients to have their ID, it's important for healthcare professionals to disclose their IDs as a means of keeping patients safe. And finally, as part of the platform, you've got the ability to take notes against patients, and you can keep that as part of your patient records, and these are time-stamped. So what's the benefit of remote consultations? I think there's a clear benefit around patient access. So traditionally, as an industry within aesthetics, we work within a local geography. Using telemedicine, that geography has significantly increased. Now we can offer a weight loss service throughout the country. So you can be based in London and your patients can be in Scotland, and that's not a problem. Telemedicine also allows you to check in with your patients more regularly than perhaps you would have done with face-to-face. I think that allows you to just ensure that the patients are on track, and if they experience any issues, you can address them early on. There's a clear convenience to patients, but there's also convenience to healthcare professionals, because those who are working in a day job or who work in a clinic and they want to kind of be efficient with their space can work around. You can offer a really flexible way of delivering these remote consultations to patients. I have to also mention at this point, there are certain limitations of remote consultations, and what Sandy's done with the National Medical Weight Loss Program is address some of these limitations through the consultation process. And some of them are obviously the inability to carry out physical examinations, a lack of patient history, but that exists for all private medicine at the moment. But again, what we've done with the National Medical Weight Loss Program is we've tried to ensure that we address some of these limitations and mitigate some of these risks. I won't spend too much time on that. So what does a journey look like for you as a healthcare professional? So your patients, when part of the National Medical Weight Loss Program, your patients will have a ready-made consultation form that they will send to their patients, and the patients would complete the consultation form, send it in, and then the patient goes on this journey, which allows you to deliver, using technology to deliver evidence-based medicine to these patients. You're then also able to, we as a pharmacy send medicine directly out to your patients, so there's a seamless process. But also what it allows you to do is consistently check in with your patient and monitor your patient so that they're on track. So the next steps is I mean, this slide here, I'm not going to dwell on this slide because it's only looking at kind of profitability. And I know the key focus here is to deliver clinically effective services. But our objective is to help you develop commercially kind of viable businesses as well. So with weight loss, I have to say that in terms of versus industry averages, it's a very generous service that you can offer. It's a commercially viable. I think it's a very sustainable service as well. So as you can see from the final column here, when delivering these services, I think you can rest assured that it's going to be a profitable service. These are my contact details. So please reach out to me or Sandy if you have any questions. I'd like to kind of finish on this point, at least from on my part, which is, since lockdown, pretty much every single course that's been delivered via Zoom has been absolutely booked out. So I think people are realizing, one, is that so many people are facing challenges when trying to manage their weight. And also there's an opportunity at the moment to help these patients using technology. And I think what Sandy's course and the National Medical Weight Loss Programme are here to do is to help you guys to deliver these effective treatments to patients. Okay, that's my final slide. I'm going to hand back over to Sandy.
Thank you very much, Cad. So, and that's really it. So we just wanted to, let's start our video again, and let me stop sharing. So first of all, if anyone wants to take down the email address or take down the website address, telephone access is limited because we've still got staff furloughed. So the best way to get hold of us is always via email, or you can go to, there is a contact sheet on the National Medical Weight Loss Programme website as well. Okay, so let me just stop sharing, and happy to take any questions.
Yeah, okay. So one of the questions is, can you do remote prescribing with this as a nurse? So that was quite early on, so I think we've covered that, haven't we?
Yeah. Is she happy that that answer has been finished? Does she want to add, he or she, add anything else?
Just ask away if there's any other questions from the audience. Do you want to go through costs, Sandy, of the training, or do you want to email that out to people after the webinar?
I'm happy to talk about that now. There's two ways that you can access training. If you pay a one-off fee, it's £850 plus VAT. But since lockdown, we've actually introduced the ability to pay that fee over 6 months. And so it's £155 plus VAT, but over a 6-month period.
That's good. And can you briefly talk around effective marketing opportunities given the POM advertising restrictions?
I'm so glad you've actually brought this up. Some of you will actually know who Lorna Jackson is. Lorna Jackson is one of the editors of Consulting Room, and Lorna actually works really closely with the National Medical Weight Loss Programme. She does all our press releases for us, but she's also just written a webinar for us all around advertising standards and what we can and can't say, that's not just relevant and pertinent to the National Medical Weight Loss Programme delivering prescription medicine, but also for those of us that prescribe Botox too. So we will be kind of putting this out there. We're only going to be charging £50 to actually join this 1 hour plus long video by Lorna Jackson, which will be absolutely outstanding. So we'll go through all of that. In terms of our adverts, our pop-ups, our leaflets, they're all ASA compliant.
Sandy, do you just want to go through briefly, I think very top line, just some of the material that they will be able to get as part of the marketing?
Yeah, sure. We have a pop-up banner, we have patient information leaflets, nice trifold leaflets, we have literally tons and tons and tons of pre-made posts that advertise the service, the program, rather than the actual drug, and that will have your clinic details on there as well. So lots and lots of information. You've got testimonials that are in there about the program, so you really do get lots and lots of support, and even support from other partners that are actually in the Facebook group. People are always kind of chipping in and saying what they do, or if they've actually had something that's worked really well, they share examples of best practice.
And what about if somebody's in Wales? Are they going to need the HIW registration to run the programme?
I don't know about Health Inspectorate Wales, to be honest. We have got maybe half a dozen clinics in Wales, but I don't know if they need to. The thing is, you have to remember we're coming at this from a cosmetic point of view. I know for his up in Scotland, there's different grades of having to go for registration. So provided we stay in the cosmetic grade, where we're not treating any diseases in the same way we stay away from CQC, we're not treating any diseases, then we can actually very safely stay in that lower bracket and not have to kind of go up to the next bracket and the next burden of then different policies and procedures and different hoops and hurdles to jump.
Mm-hmm. And then there's a question about whether it's possible to combine this with lipolysis.
I actually think, you know, even whether we're doing fat injections or we're doing any machine work as well for those individual areas to target pocket areas of fat that we want to actually help to destroy and then help the body to actually use the energy from those areas. I think it works really, really well together. So either mechanical or certainly physical like this, yes.
And then just a question about availability of the training. So do you have some dates planned in for the future?
Yeah, we've got 2 dates that are available at the moment, the last weekend of June and the last weekend of July, and those dates are the 27th and the 28th of June and the 25th and the 26th of July. So they're always on a Saturday and a Sunday, because Matt actually delivers the Saturday. So he's a full-time GP, so he has to do it in his out of hours time. And likewise, when we're all sort of not in lockdown, the majority of us work Monday to Friday anyway. So we don't want anyone to have to lose any revenue from coming to clinics or sort of doing training in clinic time.
And what about a dietary plan? Is that taught within the course? Or
yeah, we do actually go through quite a lot on diet and very low calorie diets, and we touch on all of these different things. We advocate the use of an app called MyFitnessPal, and there's lots of dietary plans in there as well that our patients can use too. So yeah, you get pretty much everything that's kind of included in the program when you're setting it up to deliver to your patients.
Well, I love MyFitnessPal.
I know, it's fabulous.
So I can vouch for it. It's brilliant.
The beauty about MyFitnessPal though as well is, you know, you're wanting your patients to actually keep a physical record of their food that they eat or the exercise that they're doing. But your patients actually can share that information with you if they say that they're actually struggling with any weight loss. Then you can really help them to kind of overcome some of the hidden calories that they'll be having and not even being aware.
Yeah, very interesting. I think it's very similar to, I guess, most of the things we do in the world of aesthetics.
Yeah.
In that it is a combination of things, isn't it? It's a combination of different, you know, some lifestyle changes, an intervention with something prescriptive, and machine modality as well. So perhaps that leads us on quite nicely to talk about our new baby, I guess, which is the UNDER. And this is definitely a webinar about the National Medical Weight Loss Programme, not the UNDER, so I'm not going to bore you to death. I've just got a couple of slides, but it might give you as well, Sandy, maybe the opportunity, if there's a couple more questions coming in on the chat, then you could reply to those just in text form, and then it gives people a couple of minutes just to think about any last questions you have for Sandy before we finish up.
Great.
So the reason that we, or I guess that the UNDER is a, oh, hang on, get my slides right. The UNDER is a good device to mention at this time is because it is extremely effective for fat loss. So, don't know why I'm at, just plug my phone in and my Apple things come up. Sorry about that. Okay. So you should be able to see my screen share now. Yeah. Okay. So at Lynton we have a device called the UNDER, and I have been fortunate enough to have one of these at home with me on lockdown. So I am a very, very lucky girl. And the reason that I wanted to take the opportunity to talk to you about it today is because it is completely different to any other body shaping systems on the market at this time. And I know that you probably feel like, you know, all the companies are telling you that their systems are different, but the UNDER is genuinely a game changer when it comes to body shaping. It would work brilliantly alongside something like the National Medical Weight Loss Programme, because it not only targets the fat, but it also targets the skin. So it will help to smooth cellulite and tighten areas of skin as well. Now, why is it different? Why is it a game changer? We have a full, 2-hour webinar on the Under, where we really delve into the interaction between the energy from the machine and the fat cell and the skin, the septate that's in the collagen and the skin within the dermis as well. So if I'm not going to go thoroughly into the science today, I'll give you a very short overview of it. But if you're interested, then I can send you the link to watch the webinar in a bit more detail. But the Onda uses a very special technology called cool waves, which is, it's an energy wave like we see a lot of in aesthetics, but it's a part of the electromagnetic spectrum which is in the microwaves section. So it's not the same as using a microwave, but it is similar that it's from the microwave section of the electromagnetic spectrum. So it just sits in between infrared and radio frequency. So it's quite a wave that is able to penetrate quite deeply into the tissue. But it is different to radio frequency in that it's more easily absorbed by fat than skin. So the problem with a lot of radio frequency devices is that they're very easily absorbed. That energy is really easily absorbed by the skin, and it's quite difficult to get it into the lower fat area. And that means it's brilliant for skin tightening, and we sell radio frequency devices for skin tightening, but not so good when you need real fat destruction, cell apoptosis. Now, the Onda works completely differently because it uses microwave. That energy is clinically proven to be more absorbed within the fat layer rather than the skin. And there's actually now a really good scientific basis behind the Onda, lots of clinical papers. It's used in over 500 clinics worldwide, a big scientific community behind it, lots of skin histologies, which are all talked through in our webinar. But essentially what it does is it causes vibration of the fat cell. So the triglycerides absorb these microwaves really easily. It causes them to oscillate. As they oscillate, they vibrate, they heat, and effectively that has the power to rupture the cell and cause apoptosis, actual cell death. There are some brilliant histologies, like I said, showing this. You can see one here that's actually showing the initial breakdown of the fat cell. You can see little vesicles around the cell here. There's the triglycerides as they're broken down into free fatty acids and glycerol starting to escape from the cell. This is an image of before treatment and 6 hours after treatment, where you can see massive disruption to the fat cells. And we've got hundreds of brilliant before and after images. So I will have a quick flip through these, but as I said, do feel free to get in touch. We can send you the link so that you can learn about this product in a lot more detail. It's extremely effective, not just on fat, but also on deep cellulite, grade 3, grade 4 cellulites, and yeah, lots of scientific evidence behind it. So if you're interested in body shaping, it's definitely worth having a little bit of a deeper look into. You like that one, I bet, Sandy, don't you?
Oh, I do. My eyes were popping out of my head a little bit. Yeah, definitely.
So we haven't seen a microwave system on the market before, apart from the Mirror Dry. That was for killing the sweat glands.
Yeah.
But this is the first one ever for fat loss. Wow. And the results are really fantastic, and DECA have got lots of clinical papers and lots of really amazing skin histologies. In fact, they've got one of the world's first skin histologies of a macrophage cell coming along and actually engulfing these broken down lipids.
Wow.
And actually moving them into the lymph system. So the webinar is really interesting. It's worth a watch.
Wow. Amazing. Okay, has anyone got any more questions for me at all before we say goodbye? I think everything.
I'll just have a double check in the Q&A.
Yeah.
There's a little question on exclusivity, I think. I'm not sure if you addressed that so far.
No, just like with Botox, we wouldn't give anyone exclusivity for this particular service in any given area, sorry.
Yeah, same for us as well. Yeah. Okay, thanks. Oh, brilliant. Okay, I'll send you some details. I'll send everyone details of the microwave system after the treatment. But thank you so much, Sandy and Kadir. Thanks for joining us. That was really, really interesting.
Yeah, we loved it. Thank you.
Really interesting.
Yeah. Okay. Thank you
right,
for the opportunity.
Thank you. Thanks for watching, everybody. Have a lovely afternoon.
Okay. Thank you.
See you all
You
soon.
too. Bye.
Bye.